Good morning, guys. So today we are going to look into the cardiac malformations. So in if a baby, a newborn baby, what are the cardiac malformations that can occur in this condition? So for your prometric examination, this is a super important area. Usually questions come from here. Okay. So let me say something. The cardiac malformations or the congenital heart diseases. Okay. The congenital heart diseases are mainly divided into three: cyanotic heart diseases, okay, semi-cyanotic heart diseases, as well as acyanotic heart diseases. Okay, it is cyanotic heart diseases, acyanotic heart diseases, as well as semi-cyanotic heart diseases. So what do you mean by cyanotic heart diseases? See, cyanotic heart diseases, simply in the simple terms, you understand that in a cyanotic heart diseases there will be proper mixing of the venous circulations as well as the arterial circulation, which means in the congenital heart diseases, if it is a cyanotic one, there will be completely change in the circulation, which means the baby will be blue in color, or which means the blood which is circulated from the left ventricle will be that of decreased oxygen status. Okay, that is simply the cyanotic heart diseases. Okay, transpositions of great arteries. Okay, that is a main thing. Transpositions of great arteries, and we'll look into one by one what all those examples. Right. Next, the next is an uh, acyanotic heart disease, which means there is no mixing of the blood, like we can say coactation of aorta. Okay, where there is only a coactation in the aorta, it doesn't cause any problem in the circulatory, or there is no problem in the circulatory mixing of oxygen as well as carbon dioxide bloods. Fine. Third one is the semi-cyanotic heart disease. In the semi-cyanotic heart disease, there is mixing of blood, that is mixing of oxygenated blood with that of carbon dioxide blood. Fine. So that is the main three congenital heart diseases. It is cyanotic heart diseases, semi-cyanotic heart diseases, as well as acyanotic heart diseases. Okay. So first, before that, you have to understand the fetal circulation. Okay. So we'll check what are the fetal circulations are. Clear. Now, and before that, some clinical manifestations. Okay, before going to those conditions, we'll generally understand what are the clinical manifestations that can occur in cardiac malformations. Okay, see, there will be dyspnea. Kindly write it down. There is dyspnea, which is especially on exertion when a person is exerting something. The there will be dyspnea, and the baby will be having feeding difficulties. Okay, then stridor will be there. What about the heart rate? The heart rate, what is the normal heart rate in the units? It is 122. Yeah. When the heart rate is more than 200, then the heart rate will be more than 200 in case of cardiac malformations. Okay. The heart rate will be more than 200 in cardiac malformations. And if it is in an older babies, like I'm not saying that in the cyanotic heart diseases, okay, no, nothing can be done in the cyanotic heart diseases. If the baby is cyanotic heart disease, soon after the birth, we'll be able to understand the baby will go into a blue condition, which is known as the blue baby syndrome. Okay, so I'm not talking about the condition of cyanotic heart diseases, but in case of semi-cyanotic heart diseases or in case of acyanotic heart diseases, in an older child, there will be restrictions in the development. Okay, delayed milestones will be there. The baby can't tolerate exercises, decreased exercise tolerance. Okay, then there will be heart murmurs. Obviously, there will be heart murmurs. Why there is a heart murmur? See, you know the heart sounds, right? S1 as well as S2 sounds. The closure of your bicuspid valve and tricuspid valve, then the closure of your aortic valve as well as pulmonic valve. This is the heart sound. No sounds apart from this have to be heard from the heart. But if there is an leaking in the heart, like we can say patent ductus arteriosus. Okay. Uh, ASD, VESD, PDA. So atrial septal defect, ventricular septal defect, and patent ductus arteriosus. These are the three things where there will be leakage of the blood, which in that condition you can hear the heart murmurs, and there will be recurrent recurrent respiratory tract infection. Okay, there will be recurrent respiratory tract infection. Okay, and kindly write the points now. See, right here, defects with increased pulmonary blood flow. Okay, so what are the defects that is affecting with the increased pulmonary blood flow that occur with the atrial as well as ventricular septal defect? Okay, ASD, VSD, and PDS. There will be increased pulmonary blood flow. Okay, there will be increased pulmonary blood flow. There will be increased pulmonary blood flow in ASD, VSDs, and PDS. Got it? So when there is an increased pulmonary blood flow, what happens? The systemic circulation will be decreased. Fine. So what shunting can you see? There is a left to right shunt. Okay. Usually there should be much importance for the left side of the heart, but in this condition, the right side will be taking it over. Clear? This is known as increased pulmonary blood flow. Okay.
സാർ ഇപ്പൊ ഒന്നുകൂടെ ഷണ്ടിന്റെ കാര്യം ഒന്ന് പറയാമോ?
Okay. So what we are explaining here is the cardiac defects, right? So there is a condition which causes an increased blood flow. Okay, increased pulmonary blood flow. What happens here? In this condition, in case of atrial septal defect, ventricular septal defect, and in the PDA, patent ductus arteriosus, these are the three conditions where you can see an increased pulmonary circulation. The blood towards the lungs will be increased. Okay, so that is ASD, VSD, and PDA. See, these are the exam points. Okay, the points which I am saying here for is for your exam. I'm not here to teach you the entire conditions. Fine, they kindly write these points in your notes so that these questions when asked you can answer it. Clear. So the point is I won't be going into deep. That is my point. I am not saying that I won't explain it, but I won't be going into deep. Okay. I just want to make sure that you are familiar with the conditions or you are familiar with the points which will be asked for your prometric exams. Fine. So as Donna had asked, what is this increased pulmonary blood flow? So the increased pulmonary blood flow means when the heart is beating, the right side, the blood in the left side, which is in the ventricles, the left ventricles, right? So the blood from the left ventricle is going back to the right ventricles. Okay, that is shunting. Right, left to right shunting. Clear? That is left. See, when your heart beats, when your heart beats, the majority of the blood will be in the left ventricle. Okay, so when the left ventricles beat, from the left ventricles, the blood is going to the entire part of the body through your aorta. Right. When there is a shunting, or sorry, when there is an ASD, PSD, or this ventricular septal defect or patent ductus arteriosus, what happens is that the blood which is present in the left ventricles or in the left side of the heart will be moved towards the right side of the heart, and it increases the circulation into the pulmonary area, to the lungs. Okay, that condition is known as left to right shunting. Is that clear? Donna, is that clear?
Yes, sir.
Okay. See, if you're not clear with the point, kindly ask. I don't have any problem in explaining it multiple times. Okay. Okay. So that is increased pulmonary circulation. Clear. So why increased pulmonary circulation? Increased pulmonary circulation affects into three conditions: ASD, VSD, and PDA. Okay. So why this happens? Because of left to right shunting. Clear. So next, second condition is decreased pulmonary circulation or decreased pulmonary blood flow. So which are the condition that causes decreased pulmonary blood flow? Tetralogy of Fallot. Okay, so tetra means four. Four conditions are there. Tetralogy of Fallot. Transpositions of great arteries. So transpositions of great arteries means aorta will be in the area of the aorta will be there in the right atrium, right ventricles, whereas the pulmonary artery will be in the left ventricle. That is transpositions of great arteries. Truncus arteriosus, tricuspid atresia. So all these conditions causes decrease in the flow to the pulmonary arteries or into the pulmonary blood flow. Okay. So you
സാർ ലാസ്റ്റ് പോയിന്റ് ഒന്ന് പറയാമോ സാർ? ലാസ്റ്റ് പറഞ്ഞിട്ട്.
ഇപ്പൊ പറഞ്ഞോണ്ടിരിക്കുന്നതാണോ?
അതെ yes. അതെ അതെ അതെ.
Sure. Normally, we are talking about some conditions or the cardiac defects. In the first one, we were talking about the increased pulmonary blood flow. Okay. So in the increased pulmonary blood flow, the conditions which increases the blood which is going into your lungs. Okay. I just I'll just explain by the right way. So first effect is decreased pulmonary blood flow. Right. This is your heart. So increased pulmonary blood flow means this is the flow to your heart. Okay. What is ASD? Atrial septal defect. What is VSD? Ventricular septal defect. What is PDA? Patent ductus arteriosus. There is a junction where the aorta as well as your pulmonary arteries meet, and the blood from the aorta will be moved towards your pulmonary artery. Okay. Here you can see here you can see a patent ductus arteriosus. Okay. But the aorta is moving right here. Here you can see a patent ductus arteriosus. So at the first point, the increased pulmonary circulation, what happens is that from this right ventricle, from this is a left atrium, right? Here you can see a what? ASD, atrial septal defect. Here you can see a ventricular septal defect. So what happens is that left to right shunting will be there. So the blood which is present in this left atrium will move towards here. Okay, in one condition. The another condition, the blood from the left ventricles will move towards here. Okay. And the third condition, blood which is going through the aorta will move towards the pulmonary arteries. Okay. So that is left to right shunting. Okay. Three conditions. So what happens when the fluid is increased, when the blood is increased in this chamber, it will go here, right? So what happens the fluid is increased in this chamber? It will go through here. So what happens when the blood is increased in this here, pulmonary arteries? Pulmonary trunk, it will increase the circulation towards your lungs, right? So it increases the circulation towards your lungs. So that is pulmonary increased pulmonary circulation. Next, second condition is decreased pulmonary circulation. Decreased pulmonary circulation. So what are the conditions that causes decrease in the pulmonary circulation? See what happens if this pulmonary valve, if the pulmonary valve is stenosed. Okay, pulmonary valve stenosis. It decreases the circulation to your pulmonary blood flow. Tetralogy of Fallot. Four conditions. We'll explain it. Okay. I just want you to understand what is shunting. That's why I'm just explaining this one. So tetralogy of Fallot. This pulmonary stenosis, pulmonary valve stenosis. Okay. Transpositions of great arteries. What is transpositions of great arteries? Aorta will be present this right ventricle, and the pulmonary artery will be in the in the left ventricle, and the aorta will be in the right ventricle. That is transpositions of great arteries. Okay. Tricuspid valve. This tricuspid valve atresia. If there is an atresia here, the blood won't flow through here, so which decreases the circulation to your blood, to your pulmonary arteries, and finally towards your lungs. Okay. So that is decreased blood flow. Kindly understand the two conditions. If what are the conditions that increases the pulmonary blood flow? What are the conditions that decreases the pulmonary blood flow? Just connect it. Okay, here you can see right to left shunting. Okay, the blood will be moving from here to here. Okay, is that clear?
Yes, sir.
And again, the atrial septal defect, ventricular septal defect can cause this. See, what if there is a defect? See, understand, like if here is a defect which is known as a atrial septal defect, okay, in the atrium, so the blood can move from here to here, right? Likewise, the blood can move from here to here also. If the blood is moving from here to here, from the right left, see, this is the left side as well as this is the right side, right? So when the blood is moving from left to right side, it is known as left to right shunting. If the blood is moving from right to left side, then it is known as right to left shunting. Simple. So in decrease in the this is the increase line. So increase in the pulmonary blood flow is due to shunting from left to right. Okay. Decrease in the blood flow to the pulmonary area is due to shift of right to left shunting. And is that again clear?
Yes, sir.
Okay. And a third condition. So the two conditions which we have explained is decreased pulmonary circulation, increased permanent circulation, decreased permanent circulation, and third one is obstruction. Obstruction. So what are the conditions that causes obstructions? Okay. So the obstructions are main one is coarctation of aorta. Your aorta will be coarctated. Okay. There will be a stricture in the aorta. Okay. This is coarctation of aorta. Here what happens? There is an obstruction, coarctation of aorta. When there is a stenosis, pulmonary artery stenosis, aortic valve stenosis, bicuspid stenosis, tricuspid stenosis, all these stenosis will cause obstructions. Okay, so these are the main uh, defects which can. But I just want you to understand what is shunting. Okay, so that was the shunting. And the clinical findings we had said there will be dyspnea, then feeding difficulties, delay in the milestone, respiratory infections will be there. Then um, one thing, just kindly mark it star. So the condition is the baby will be in the squatting position. The baby, in mainly in case of semi-cyanotic heart diseases, the baby will sit in the squatting position, which helps to decrease the venous returns to the heart. Okay, thus lowering the cardiac workload. Squatting position or squatting position is simply your knee chest position. Okay. The baby will sit in a squatting position. Squatting position is simply how you sit in an Indian closets. Okay, that is a squatting position. So the baby will sit in the squatting position in order to decrease the cardiac workload. Then, then it may leads to these conditions may leads to cardiac failure. Okay, it may leads to cardiac failure. See, there will be tachypnea, dyspnea as well as tachypnea. Weight gain will be the ascites, pleural effusion, pulmonary edema. Okay, those are the main signs of cardiac failure in these conditions. See, all these conditions are surgical conditions. By giving medicines, we can just decrease the symptoms. Okay, that's all. So the main, so I hope this is clear with you. So shall I move to the conditions? Okay. So now the conditions. Yeah. So just a minute. Let me stop this. Okay. Fine. We go with the yeah. First condition. Write it here. Write down. So I said we have cyanotic heart diseases, semi-cyanotic heart diseases, as well as acyanotic heart diseases. Okay. So first we'll go with the acyanotic heart diseases. Or here before that we'll just understand what are the circulations. You know the normal heart circulation, right? Now you want to understand what is the fetal heart circulation. So the shape of the heart is cone shaped in a size of one's fist. So just leave those in. The thing which we want to know is the fetal circulation. See, you all know this fetal circulation. It, even though I am just explaining it once again, the fetal circulation is carried from your umbilical vein. The umbilical vein is the oxygenated blood from the placenta. Even though the umbilical vein carries deoxygenated blood for the mother, okay, but the amount of deoxygenated blood for the mother is the oxygenated blood for the fetus. Okay, so the umbilical vein carries the oxygenated blood from the placenta. Again, I'm explaining this umbilical vein is not an oxygenated blood. Okay, this umbilical vein is also a deoxygenated blood. But for the baby, this oxygen is far more enough for the circulation. The umbilical vein from the placenta, it enters into the fetus area. From the placenta, it enters into the fetal area. Okay, so when okay, it goes towards your superior vena cava as well as your inferior through your inferior vena cava. Now, there is a condition where the liver bypasses it. Okay, so that is known as ductus venosum. Ductus venosum. So what is ductus venosum? When the umbilical cord passes through there is a mixing of blood at the area which is known as ductus venosum near the liver, where the blood is mixed with the uh, fetal circulation. Okay, so that is ductus venosum, which goes into your what? Into your heart. Now the heart. Okay, the heart. Here, the blood reaches through your inferior vena cava. Okay. Now, from the right atrium, it should go to the right ventricles, right? For why it should go to the right ventricles? Because the blood have to go into the pulmonary circulation. Sorry, into the into the pulmonary circulation, into your lungs. Now, in the fetal condition, the lungs are not working, right? So the pulmonary circulation will be having high resistance. Due to that high resistance, the blood due to the high resistance, the blood won't go into the pulmonary circulation. Okay, rather than the right ventricle will be facing an immense pressure. That's why the blood which is entering into your this right atrium, the blood which is entering into your right atrium won't move into your right ventricles. Rather than it moves through the foramen ovale. Okay, here it will move through this ovale, this opening. Okay, and this from the right atrium, it will reach the left atrium. Okay, then from the left atrium, the blood passes to the left ventricles. Then from the left ventricles through the aorta, the blood passes through the pulmonary arteries and to all the parts of the body. But again, here is a catch. Here we have the patent ductus arteriosus, right? So the pulmonary veins. the pulmonary veins. The aorta which is going through, there will be an opening where it touches the which where it touches the pulmonary trunk. So where it touches the pulmonary trunk, there is a defect known as patent ductus arteriosus (PDA). Or patent. We can't say patent. Patent is a word which we'll be using after the birth. There is a ductus arteriosus. Okay. So here is ductus arteriosus, where again the mixing of the blood happens. Okay. I think this is clear with you. I'll I'll explain it once again. The heart, mhm, from the umbilical vein, and the umbilical vein where it meets the liver. Here there is a ductus venosum. Okay, where the mixing of blood once happened. Okay, then to the inferior vena cava, it enters into your right atrium. From the right atrium through the foramen veil, it moves into your left atrium. From the left atrium into your left ventricles. From the left ventricles through your aorta, it moves. Okay. Then ductus arteriosum, where it meets the pulmonary circulation. Okay. Here there is a ductus arteriosum. This is how the blood is transported to the body parts. So now after this, it will be transported to the entire body parts. Okay. So that is fetal circulation. Here. So the cyanotic heart diseases. Simply the cyanotic heart diseases. This acyanotic heart diseases are very common in case of congenital heart diseases. Okay. So it may affect the heart or the great vessels of your heart. That is a acyanotic heart diseases. Okay. Then, what are the causes? What are the causes of these acyanotic heart diseases? So there it may be a genetic disorder. Okay, there will be chromosomal abnormalities, or there will be fetal circulation, fetal placental circulation, teratogenic infections like rubella. Rubella infections may cause teratogenic drugs, which causes what significant anatomical changes to the baby. Alcohol intake by the mother, fetal hypoxia. So this fetal hypoxia in the early stages, not in the late stage. Okay, it's not after the what formation of the enzyme, I think, but fetal hypoxia in the early stages. Birth asphyxia. So when there is a asphyxia, there is a chance for non-closure of these the areas, right? Like the ductus arteriosum. Soon after the birth, it will be converted into ligamentum arteriosum. Ductus venosum again into ligamentum venosum. This then foramen ovale will be also finally closed soon after the baby takes a first birth, first respiration. Okay, so all these things functionally closes within some minutes and hours. Okay, so if there is an asphyxia to the baby is not taking a breath properly, then these areas may be opened. Okay, now the conditions which the conditions which diminishes the blood flow. Okay, pulmonary, which we have said, the left to right shunt. Okay, these are the points which we have explained. Okay, the separate defects as well as coactations where you can see a left to right shunting. Now, the atrial septal defect. See, what is an atrial septal defect? The atrium is in the is there a problem in the atrium, right? So why there is a problem in the atrium, ideas? See, the usually the heart in the fetal condition, this is a normal pathway of the blood flow, right? This is a normal pathway of the blood flow. The blood from be moving from the right atrium to the left atrium. So this is a normal pathway. Soon after the birth, what happens? What happens? See, this is your pulmonary artery, right? So soon after the birth, the baby take the first breath. So when the baby takes the first breath, the lungs will be automatically functioning. Okay. So when the lungs is functioning, so normally we have the pulmonary arteries, I think, right? So this is your lungs. Hmm? So soon after the baby take the first respiration, hmm, when the baby take the respiration, this is the lungs, right? When the baby takes a respiration, the resistance towards the lungs through these pulmonary arteries will suddenly disappear. Okay, so when the pulmonary trunk disappears, what the resistance, the blood will be taking the blood will be taking through here. Okay, so when the resistance is over, the blood which was going from left atrium to the right atrium through this septal defect, through this atrial septum, will close automatically. Okay, that happens soon after the baby takes the first breath. So due to the first breath, the resistance decreases. Since the resistance is decreasing, the blood from the right atrium will be moving towards the right ventricles. Okay, this it will functionally disclose this septum. Okay, this foramen ovale septum. So in some conditions, the causes which we have explained earlier, in all their conditions, mainly in birth asphyxias, this will be opened. Okay, this area will be opened, which leads to atrial septal defect. Likewise, we have the ventricular septal defect also.
സർ
Okay,
ഇതൊന്ന് സ്ക്രീൻ ഷെയർ ചെയ്തൊന്ന് എക്സ്പ്ലെയിൻ ചെയ്യാവോ?
you are able to see this, right? So ASD, atrial septal defect. Okay, normally what happens? The Normally what happens? The blood which is coming through the inferior vena cava enters into your uh, atrium, and it moves to the left atrium. So this is a normal pathway, like right atrium to left atrium. This is the normal pathway, right? This is a normal pathway which is gonna happen. Soon after the baby is delivered, okay, soon after the baby is delivered, the baby takes its first breath. Okay. When the baby takes the first breath, what happens? The resistance which was there into the pulmonary arteries decreases. Okay, that is the main point. The resistance towards the pulmonary artery decreases. Why resistance decreases? Since the baby have taken the first breath, the lungs is activated. Okay, when the lungs is activated, the lungs take the air inside the lungs. So the lungs is activated, which means there is no point in getting the blood from the fetal circulation, or there is no blood which is coming, the oxygen which is coming from the mother. Soon after the baby takes his first breath, the lungs is taking over the charge of getting blood circulation, getting oxygenation to the blood. So once the baby is delivered, it takes the first birth as a first cry, right? So the first cry, when the baby cries first, the lungs resistance will be decreased. So when the lungs resistance will be decreased, the oxygen will taken into the lungs, and the circulation starts. So when the resistance decreases, when the resistance of the pulmonary artery decreases, soon this block, or this the blood flow from the right atrium to the left atrium will be stopped. Why? Because the pressure here is decreased. So when the pressure at this point is decreased, the blood will ooze out here. Okay, that's why what if we have to say, the pressure in the right atrium will be less than that of the pressure in the left atrium. So from the lower pressure to higher pressure, the blood can't flow. Okay, and the left atrium, see, this opening is a one-way opening, right? So due to the high pressure in this chamber, this will be closed, and no blood will be able to pass through here. Okay, and from where this left atrium gets the blood, the left atrium gets the blood from this pulmonary veins. Okay, from where the pulmonary vein, since this is activated, the pulmonary circulation is activated, the lungs will take the oxygen and it will return it back to the heart through the pulmonary veins. Okay, so then it happens, it functions as a normal circulation. So this is right atrium as well as a left atrium. When there is a decrease in the resistance of pulmonary circulation, the blood should be passing from right atrium to left atrium, right? In some conditions, this won't happen, okay, due to birth asphyxia. Okay, in those conditions, this will remain open. Okay, this will remain open. That condition is known as atrial septal defect. Okay, second condition is ventricular septal defect. Same condition happens here. Okay, same condition happens here in the ventricles. Okay, the left to right shunting will be there. Left to right shunting will be there. So when the ventricular septal defect is there, this shunting will be open. Okay, so which means there will be mixing of blood. Here also mixing of blood will be there. See, actually, the ASD, VSDs, and PDS mainly comes under the semi-cyanotic heart diseases also. But usually we are just if in a manner, if you want to into classify it into cyanotic as well as acyanotic, all these things comes under your acyanotic heart disease. Okay. Now is that clear?
Yes, sir.
Okay. And again, the tetralogy of Fallot. The tetralogy of Fallot are those conditions which have four conditions, which is characterized by ventricular septal defect, this right ventricular obstructions, overriding of aorta, and right ventricular hypertrophy. Okay. Kindly write it down with the tetralogy of Fallot. The tetralogy of Fallot. These questions are most asked. So, which is not here in the tetralogy of Fallot. Tetra means four, Fallot means fetus. So, tetralogy of Fallot, first one is ventricular septal defect. Okay. Second one is this right ventricular outflow obstruction. Third one is overriding of aorta. Fourth one is right ventricular hypertrophy. Clear? Guys, are you able to follow?
Yes, sir.
Yes, sir.
Yes, sir.
Pratibha, Saumya. So, going back to the slides. What were we talking about? We were talking about China. Okay. So that is atrial septal defect, right? Hmm. See, all these things I have explained. Okay, what is atrial septal defect? Now, atrial septal defect. Just leave this. There are some types. No questions will be asked. Okay, just leave it. Leave it. This is for the MSc classes. No, just leave it. See, prometric won't ask such kind of what the types of atrial septal defect. Okay, so this you can study when you move into MSc nursing. No need of these things. No, the pathophysiology, I have explained it, or the pathophysiological condition. Now, what are the diagnostic feature? When taking a chest X-ray, when an ECG, a cardiac catheterization, even a physical examination will you can understand these things. Okay. Oh, kindly write this down. Complications. There will be what I have said. There will be recurrent respiratory infections. Okay, there may be recurrent respiratory infections, which further leads to infective endocarditis. Pulmonary artery hypertension. Why pulmonary artery hypertension? Because the circulation towards the pulmonary areas increases. Third one, growth retardation. Okay. There will be growth retardation. I mean, congestive heart failure. Atrial fibrillation. Yeah, usually it's a rare complication. But anyhow, see, medical management, what I had said, just symptomatic management. Okay, surgical heart management, management. What we'll do? See, what is the problem? The atrial septum is defected. We'll stitch that area. That's it. Okay. Track and patches. If the area is very prominent and precisely very open. Next condition is ventricular septal defect. So if you know what is atrial septal defect, likewise it happens into the ventricles also, which is known as a ventricular septal defect. Okay. Now, the clinical features, the poor feeding, growth. See, you can see all the clinical features are same in case of ASDs and VSDs. Okay, tachycardia, poor gain, ventricular hypertrophy, all those. Again, you can see in the histories as well as physical extension. Same diagnostic evaluations. See the complications, same complications. So ASDs and VSDs are more or less similar. You have to. What was the management of the what was the surgical management of ASD? We were closing it, right? Likewise, we'll close the VSD also. Okay, same condition. Next, patent ductus arteriosus. This is PDA. I have explained it, right? So you can see the aorta as well as the pulmonary arteries. There will be a connection between the pulmonary artery as well as aorta. Usually that connection is normal if it is a fetal condition. Soon after the birth, it have to be closed. Usually it takes time, okay? I'm not saying that the patent ductus, the ductus arteriosus will be closed soon after the birth. Soon after the birth, the circulation from the right atrium to the left atrium, the right atrium to the right, sorry, what is that? Right atrium to the left atrium will be closed. Okay, soon after the delivery, when you take the first breath, that is the first and a functional thing that to be has to be closed. Okay. After that, other things, the pulmonary, the ductus arteriosus and other things will take time. So the patent ductus arteriosus. This is a patent ductus arteriosus. Now you know that again, same clinical features. Okay. Same clinical features. Diagnosis also same. Complications also same. Okay, so ASD, VSD, PD, if you study one thing properly, you can understand the three things. Okay, see, we have opened a heart which shows the uh, patent ductus artery. This is a small thing. We'll just future it. Okay. Now, coarctation of aorta. How I have explained the coarctation of aorta, right? See, you can see this coarctation of aorta. Normal aorta, which is coming right at here, and there is a kinking. This is coarctation of aorta. Okay, so what happens when there is a coarctation? Blood won't pass through the aorta freely towards the heart, towards the body parts. Okay, so when there is coarctation, the pressure increases here, right? There will be reverse pressure will be here, so that your left ventricle will be hypertrophied. Okay, that is the main complication, and there will be decreased circulation to the body, which affects the entire body parts. Okay, so if there is a coarctation of aorta, it may be associated with VSDs and PDAs. It is not sure, it is not mandatory that it must be accompanied, but there are chances that it may be accompanied. Then what happens? Blood pressure will be higher. Then the leg as well as your peripheries won't receive the actual amount of blood that have to be uh, that have what they have to get it. Okay. Then your legs will be cooler than the arms. When the circulation is diminished, what happens? Muscle cramps, all those things happen. Hypertension, tachycardia, endocarditis, all those things happens when simply taking a chest X-ray, we can understand whether there is a cardiac malformation or not. Echo, all those things. Doppler, cardiac catheterizations, like complications. This is the main. There is a main complication which causes or which leads to aortic aneurysm. Okay, because of high pressure in the aorta, it leads to aortic aneurysm. That congestive heart failure, the heart failure, because the when the ventricles are increases, when the size of the ventricles increases, which further leads to congestive heart failure. Okay. Next, intracranial hemorrhages, IC bleed will be there. What is the management surgically? You have to graft it, or you have to just open the and this aortic area, or we'll just remove that aortic area where there is a stricture, and we'll reconnect it with the other parts of the aorta. Okay. See, balloon angioplasty. See the balloon, which this is for the what coronary artery surgeries. Okay, plaques are there. So nursing management, pre-operative, post-operative nursing management, all those things. So that's why I'm not giving much emphasizing on that. So that was about the acyanotic heart diseases. So any doubt in this acyanotic heart diseases? Guys, are you having any doubt in this acyanotic? Yeah, so we were talking about the acyanotic heart diseases. Now we'll go into the cyanotic heart diseases. So the cyanotic heart diseases. Okay. So which are the cyanotic heart diseases, or what do you mean by cyanotic heart diseases? Cyanotic heart diseases means the conditions which completely mixes your blood. It is not just mixing, it is just replacing the circulation. Okay, that is which the baby will be completely turns into blue, which causes which causes a problem with the circulatory problems, like the carbon dioxide will be supplied to your entire body, not the oxygen. That is cyanotic heart diseases. So cyanotic in the conditions, the cyanotic conditions, that is pulmonary blood flow problem, which is completely a condition of you can see with the problems of the pulmonary. Second one is with the mixed blood flow will be there. Okay, so pulmonary blood flow as well as mixed blood flow. This pulmonary blood flow in tetralogy of Fallot. We have explained what are the tetralogies of Fallot's, right? So that is those are the conditions that causes the pulmonary blood flow problems. And and you can see tricuspid valve atresia also. Tricuspid atresia, which the stenosis, usually the stenosis. And next is the mixed blood flow. Okay, so we'll check one by one. The tetralogy of Fallot. What is the tetralogy of Fallot? Pulmonary stenosis will be the or ventricular septal will be the overriding will be the and left ventricular hypertrophy will. We have explained this tetralogy of Fallot, right? So that in the tetralogy of Fallot, what is the main thing which you can see is the four defects, which as we have explained the four tetralogies, ventricular septal defect, which means what is ventricular septal defect? This is a ventricular septal defect. Okay. Pulmonary valve stenosis. What is pulmonary valve? The valve here, pulmonary valve stenosis. There will be overriding of aorta and right ventricular hypertrophy. Okay. See the narrowing of the pulmonary valves. There will be narrowing of the pulmonary valves. There will be thickening of the right ventricles, which is right ventricular hypertrophy will be there. Okay. Then ventricular septal defect. Here there is a defect in the ventricular septum. Displacement of aorta. Okay. The aorta will be displaced to some another areas, or the aorta won't be properly there in the left ventricles. Okay. Now, what happens? See, we don't have to focus on these pathophysiologies. Okay, just when the blood flow normally returns to the how the normally happens from the right atrium to the right ventricles, to the right ventricle to the pulmonary arteries, and that come back to the heart through the pulmonary veins, right? So here what happens? Right ventricles, since there is a pulmonary stenosis, then there is a pulmonary stenosis. It increases the right ventricular pressure, which again causes ventricular septal defect. Okay, see the heart. Here there is a pulmonary artery, and if your pulmonary artery, this pulmonary valve is stenosed, what happens? The blood have to go back either. See, this is the area, right ventricles, where the this is the right ventricles where the blood is pulled into, so that it can go into the pulmonary circulation. If there is a stenosis of this valve, what happens? The blood inside this will be having a greater pressure. It can't go up. Okay, it can't go up because here there is a valve which prevents it from going up. So there will be left ventricular hypertrophy. Okay, here there will be left ventricular hypertrophy. It will increase the size. Again, see, we have an opening here. So the blood will try to move through this opening, which is known as ventricular septal defect. Okay, so this pulmonary stenosis is the main cause, which causes a left ventricular hypertrophy, and there will be VSD. Okay, see, when the pressure inside this ventricles is such huge, it will compress this septum, this entire ventricular septum, to a bit here, so that the aorta may have a, see, here is our aorta, right? So due to this condition, the aorta may be taken up, and the aorta may be at this junction. Okay, which causes aortal abnormalities also. Clear? So right here, what happens? Right to left shunting happens. Okay, hypertrophy of the ventricles. I said what is the reason for the hypertrophy of the ventricles? Okay, and the ventricles is unoxygenated and cyanosis results. Clear? Low oxygen level. It can be mainly, see, we have two types of cyanosis: central cyanosis as well as peripheral cyanosis. So central cyanosis can be seen in eyes, tongue, lips, and so on. Okay. So the here, when the child is having tetralogy of Fallot, the child will have a bluish discoloration when the child is crying or feeding, because when the cry happens or when the feeding happens, the oxygenation won't takes place because of this deglutation. What are the clinical manifestations? Cyanosis. Okay, cyanosis, clubbing of fingers and squatting position. I have said what is squatting position. Dyspnea. Okay, then cerebral ischemia is because, see, anything which is associated with decreased oxygen, any complication, any symptom which is associated with decrease in the oxygen in the tissues is a clinical manifestations of these central the cyanotic heart diseases. Okay, then on auscultation, murmur, definitely murmur. See this one, boot shaped heart, X-ray finding. There will be boot shaped heart or a wooden shoe appearance. It's a wooden shoe appearance. In ECG, right ventricular hypertrophy. Anybody remember we have said in the ECG what is the fighting of right ventricular hypertrophy in the ECG? Anybody? Rajesh, can you remember? Right ventricular hypertrophy. What is the findings of right ventricular hypertrophy in ECG? Pratibha, anybody? So the management, surgical management, we'll do the shunting. We'll all surgically correct all those things. Now, understand the surgeries. Now we are going into cardiac surgeries. Spots procedure. Kindly note this point name. Spots procedure. Okay, here what happens? The aorta is anastomosed with left pulmonary artery. The upper descending aorta is anastomosed with the left pulmonary artery. Okay, aorta will be anastomosed with left pulmonary artery. Why is it so? We are making an artificial patency. Okay, we are making an artificial patency. Next is Watterson's shunting. Here again, aorta is anastomosed with the pulmonary artery. Brooks procedure, pulmonary valvulotomy to correct the to correct the stenosis, pulmonary valve stenosis. Okay, to correct the pulmonary valve stenosis, Brooks procedure will be done. Ford procedure, Watterson, at least understand that Ford procedure, Watterson procedure is associated with the surgeries of the statologies. And complete repair, we'll completely repair that. What are the complications? Like if there is a VST, we'll remove that. Or if there is stenosis, we'll remove that. So we will understand what are the complications or what are the problems which are directly associated with all these problems, and we'll completely repair the entire thing. Okay. Now, tricuspid valve atresia. What is this tricuspid valve atresia? See, the tricuspid valve is the area where where your right atrium communicates with the right atrium communicates to the right ventricles, right? So, if the tricuspid valve is having any problem, it will leads to these atresias. Okay, so you have to simply it is associated with pulmonary this pulmonary stenosis or tricuspid valve stenosis. So, just removing that valve. Okay, we'll just remove the tricuspid valve atresia. See, in heart diseases, mainly in congenital heart diseases, cyanosis is the main complication. Dyspnea, hypoxia, clubbing of fingers, all those things will be the. And see, one point in case of PDA, the medicine which we'll be giving is prostaglandin. Okay, until the surgery is completed, prostaglandin will help to maintain that. Kindly see, don't go into the pathophysiology of how the prostaglandin acts. Simply understand that in case of PDA, we'll give the prostaglandins. Okay, until the surgery is performed. Surgical management. What are the see the surgical again the surgical management. The we'll just remove the problem. So first understand the problem. No, I'm not going into deep. Okay. Now next condition is transposition of great arteries. The main uh the main what the cyanotic heart disease, transposition of great arteries. Simply it is like that. See, here there must be pulmonary artery. Here there must be your aorta, right? This will be transpositioned. So here your aorta comes, here your pulmonary artery comes. So the oxygenated the aorta which have to take the blood to your different parts of the body will receive the blood from your right ventricles. So this is the deoxygenated blood, right? This is the deoxygenated blood. So this deoxygenated blood will be again taken into your body, whereas the pulmonary artery which is present in the left ventricles, the blood which is in the left ventricles are oxygenated blood. This pulmonary artery will take this oxygenated blood again into the lungs for the what circulation for increasing the oxygen level in that. This is transpositions of great arteries. Okay, so simple. Where it should be it will interchange its position. Ventricles, it will interchange the ventricles. So simply cyanosis, heart failure, weight gain. See, clubbing of fingers, slow weight gain, rapid breathing. It won't go to that much. Soon after the baby is delivered, we can understand the baby is having a what there is an cyanosis. Actually, the baby can survive up to a minimum extent. Why? Because there is patent ductus arteriosus, VSD, ASDs, and all those septum won't close. There will be functional close. Okay, the functional close happens at some hours. Like the ASD will take some hours to close. So this delay in the functional closure is maintaining the life of that baby. Okay. Anyhow, the baby needs oxygen to your entire tissues to work. So in this condition, if there is an opening, if there is an abnormal openings, these abnormal openings will help the baby to survive for a little longer time. So as the medical attendance is given to the baby. Okay. Usually now in these conditions, soon we'll be doing the surgery, we'll be doing the scans, and we'll be able to understand, identify the diseases which is affecting the baby. Fine. So that these conditions are not unattended or unnoticed. Fine. So this is explanation what I have given. See, diagnostic evaluation, there is no point in going for X-ray, ECG, all those things. Just looking at the baby will be diagnosed. Okay, and this is the confirmatory test. Okay, just if you are saying that, first we'll go for cardiac echocardio. Okay, then yes, kindly study these surgeries. This is the main surgeries for the tetralogies of the character. Blalock procedure. Okay, Blalock procedure and Rashkin procedure. Okay, Blalock tossing procedure or Blalock Hanlon procedure and Rashkin procedure. So what is a Rashkin procedure? Rashkin procedure, we'll just enlarge the septal defect. Okay, we'll just enlarge the septal defect so that there will be a mixing of blood and the body receives some oxygen. Okay. Blalock surgery is again, we'll create an enlargement in the atrial septal defect. Same. Blalock as well as a Rashkin procedure is same, but there is difference in this the approach as well as the size made for the surgeries. And the corrective surgery is mustard operation. Corrective one is mustard operation. We'll completely take the aorta and we'll place it in the ventricles. We'll take the pulmonary artery and we'll place in the right ventricles. That is the corrective surgery, mustard procedure. Okay. So nursing management, rest. We have to avoid crying. See, you have to avoid excessive crying. Okay. So the baby should be attended early. Then cardiac failure, you have to check for the cardiac failure. Oxygenation, you have to separately give oxygen. The baby will be in the oxygen hood. Then diuretics to reduce overhydration. Okay. Fluid and electrolyte imbalances. You have to check for the acidosis. Which acidosis? It is respiratory acidosis. Okay. Because we are oxygenating the baby, the circulatory problem will be the baby will be more or less electrolyte imbalance will be there. So you have to check for that. Provide psychological support to the mother, family, not to the baby. Okay, and to watch the complications and so on. So that was about the tetralogy. That was about the tetralogies of the palate and other conditions. So guys, are you having any doubt on this? Any doubt?